I think it's time to do the CIBC twist on things. I think it's time to add a bit of that CIBC flavor, like, let's make chronic pain great again.
It was absolutely not game-changing, it was life-changing. I had no idea that there is not one, not two, not three, but 4 histamine receptors on your nerve.
Be a discussion about chronic pain, which is a very serious condition, but I think it's time to do the CIBC twist on things. I think it's time to add a bit of that CIBC flavor, like if it's like, that guy, that, what's that mean? Salt Bay, a little flavor.
Let's make chronic pain exciting.
Let's make chronic pain great again.
That's my line.
So we're going to go into chronic pain because this came across as a request. A couple of people were asked us about like why, in particular, why we were talking about using the Toxaprevent skin suspension on inflamed areas. That's where the chronic pain thing came from me.
Oh, really?
And so I'm guessing you got a different question about chronic pain, right?
I mean, I think chronic pain has always been on my mind, on the back of my mind, because, I mean, it's something that I've struggled with for, I used to suffer with, God, more than half my life.
Mm-hmm.
And it's, obviously we get a lot of questions about histamine in particular. I mean, we know a lot more than just histamine, but we do get a lot of questions on histamine, and it's something, was it Abby that mentioned that there was a lot of questions around it or something? And it's just something I wanted to highlight. Like, I don't necessarily want to have, a big investigative deep dive into chronic pain. We can certainly do that. But I know for me, I wasn't aware of the link between histamine and chronic pain. And when I learned about that link, it was absolutely not game-changing, it was life-changing. It absolutely changed my life.
I want to hear a little story about B&T when I first laid eyes on her. Do you not remember? I tried to persuade you with the suspension. I was like, Tracy, here's a Toxaprevent skin suspension. You should apply it to, because we were talking about it. Do you remember the conversation?
I really do not remember.
This was at a conference, and me and you were talking. It's where I secretly fancy Tracy. I was like, how am I going to get to talk to this girl?
You weren't being very secretive.
Yeah, I wasn't very subtle.
Yeah.
I'm about subtle as a gun, right? But anyway, I remember speaking to you and giving you the skin suspension, and you were like, "Oh yeah," and I was like, "Oh, do I like try and sell it to her, or do I just give it to her free and be like a nice guy?" I still remember that story, like brazen into my memory. So yeah.
All I remember is I didn't pay for shit.
You just got it all free. It's just like, give me the Toxaprevent goods, give me the Toxaprevent goods. But it was actually you that led me to the chronic pain thing, into the histamine aspect of it, because a lot of people talk about chronic pain, but no one talks, because you did the video talking about SSRIs given to chronic pain people because it's all in your head, as they say. When you look at neurotransmitters that increase our brain activity, that makes us function, they talk a lot that people can't tolerate, so like chronic pain sufferers can't tolerate caffeine because it makes all their muscles start to hurt, muscles start to ache. And it's interesting that no one's talked about the role of histamine in this.
Particularly, I just want to point out, particularly for neuropathic pain, so people that experience nerve pain. Now, if you look up if you kind of Google chronic pain and histamine, it will mention there's a strong link between histamine and joint pain and even musculoskeletal pain, but in particular fibromyalgia, which we know definitely has a psychosomatic element. I know I just spent another video talking about my issues with that term, but as long as it's used correctly. And so, but in particular, neuropathic pain and histamine, I think, is where the money is at, because I don't know if you were aware of it. I don't think you were, because when we had that conversation years ago, but as someone who suffered from debilitating neuropathic pain for years and years and years, I had no idea that there is not one, not two, not three, but 4 histamine receptors on your nerves.
Hmm.
Why do we not talk about that?
It's because like a lot of the time we're not talking about it because the solution's too easy, and that's the issue. Like there are 236.9 billion reasons, and people can wonder why I use that exact figure. If you Google the antihistamine market net worth, you'll find out the reason why there's 236.9 billion reasons why we don't look at the histamine. We talk about the receptors in that way, but as in blocking the receptors.
But yes, and maybe it's changed because thankfully I have managed to stay out of the hospital for quite a while now. So maybe the approach has changed to neuropathic pain patients or chronic pain patients. But like, I was never even prescribed antihistamines. Like, it wasn't something that was ever discussed. I was prescribed every other medication, but never antihistamines for chronic pain. So I'm not completely sure that it is something that people are aware, even if they want to go down the pharmaceutical route, you know? And don't get me wrong, I had been on antihistamines on and off for most of my life because as with most histamine sufferers, there's always little histamine things that you'll experience throughout your life. So mine was chronic hay fever and estrogen dominance and, the hormonal things that go with that. And then obviously chronic musculoskeletal and neuropathic pain and hypersensitivity and EDS and all of these things. But it wasn't until it hit that pinnacle of chronic pain where, it was so debilitating that you can't live your life that you're kind of like, oh, actually, if you look back at this history, there's lots of histamine related things in this history, but it's just not something that's spoken about. And I feel like I feel like I'm totally rambling because I don't even know what point I'm trying to make, other than just bringing awareness to the fact that if you struggle with chronic pain, please look at histamine as an element. And obviously, if you listen to our other stuff, you know that I'm not going to recommend long-term antihistamines. But even if you want to go on long-term antihistamines, just do something around the histamine aspect because it is life-changing. Because that excess histamine is constantly stimulating that neuropathic pain. It's driving that signal to be like, ouch, 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 and
Inflammation on the pathway.
driving inflammation, driving that signaling, telling that, sending that message from brain to body to be like, we're in pain, we're in danger, we're inflamed. And what's so amazing is that it's something that you can address that not only can help with the pain aspect, but it can help with all of the other things that, because I've never come across someone that has had a condition associated with histamine, like chronic pain, like burning mouth syndrome, a lot of menopause cases that don't have other symptomology associated with histamine. So when you're addressing that big symptom, that big condition, that big issue, you're actually also helping the whole body, all of those other little niggling symptoms. So yeah, I don't even know what I'm trying to say.
I mean, what you're trying to say to
other
people,
than just to highlight that.
I mean, you're highlighting a very important topic here, because it's not, but just to add on to what Tracy's saying is, it's not just about taking an antihistamine, it's about finding the right antihistamine to take, because every antihistamine, they're different ones are designed for different aspects. Some are designed for the histamine 1 receptor, histamine 2 receptor, histamine 3 receptor, histamine 4 receptor. It's like,
And it's trickier with nerve pain in particular because you do have all of those receptors on your nerves, as we were talking about in another video about the burning mouth syndrome. Like that specifically, you want to target the H1 receptor. So there's going to be a little bit more trial and error with something like nerve pain.
and this is the thing, like, just to prove your point, like, for example, histamine 4 receptor antagonists, right? So we actually didn't know that histamine 4 receptors were linked with rheumatoid arthritis. I mean, the fact that when they've now, so the research went that they triggered mice to have histamine reactions into their joints, and they basically triggered mast cells in their joints, right? The mast cells activated, they then released histamine to the joints. There was inflammation there. And this researcher came out many years ago, was like, nope, it's not true. Histamine doesn't play a role in rheumatoid arthritis. Scooch on about 8 years later, they actually then started looking at mast cells and inflammation in physical joints for rheumatoid arthritis. And a pharmaceutical company, the first letter beginning with J and the second part of the name beginning with J, suddenly turned around and they actually did a research study, and they were like, oh, look at this. We've actually got histamine receptors in our joints, and we now know that if mast cells are activated in there, it creates inflammation, which obviously mast cells release histamine alongside the cytokines. And what we need to do is create a histamine 4 receptor antagonist, so an antihistamine for that histamine receptor. And then if we turn that receptor off, then symptoms are gone. And so you got to ask yourself that $1 billion question, because 236.9 billion, if they didn't believe it was true, now why do they do it? So, and because
there's a market.
Because there's a market for it. So that's not me trying to be controversial. I'll link the papers, I'll link the research, I'll even link you the actual patent that's been filed for that receptor. So histamine plays such a massive role in the system with chronic pain. Please don't get me wrong, it's not a be-all end-all solution, but it will give you some damn good results, because then you've got to go to, like, looking at like vitamin D like symptoms, nutrition,
but my God,
minerals.
will it allow you the room to breathe?
There you
Because
go.
it's that, particularly with pain, it's like the mountain really is that constant reactivity. It's that constant spark. It's that constant if you graze your knee or you cut your leg, that's painful, right? Imagine having that 24/7 every day. Like, all you focus on when you cut yourself is that cut. So you go and you get your first aid kit, you wash it out, you wrap it up, sometimes people might pop a painkiller, and you really struggle to focus on anything else until that pain is relieved. So imagine in the case of someone that has chronic pain, where it's just that constant spark, you can't focus on anything else. Like, you literally don't have the physical or mental capacity. So addressing something like the histamine just gives you enough breathing room to be like, okay, what else do we need to look at? If I don't want to be in this situation for my whole life, which who does? What else do we look at it? And how do I solidify this feeling of reduced pain? How do I even go to the point of no pain? Which is possible, by the way, because I know what it feels like to feel like this is forever. But you need to create the breathing room.
I'm going to link the protocol below that we suggested. I'll link the research below, and let us know, as you reduce the histamine, what happens. I'm intrigued to see what the feedback is. If it's good, if it's bad, let us know the symptoms. I'll be really intrigued.
I'd also really like to know if you've ever been diagnosed with chronic pain, or even in absence of a diagnosis, do you experience chronic pain, and are you aware of that histamine link? Is it something that you've come across? whether it is or it isn't, now that we're talking about it, can you identify any other areas in your life that could be histamine related? You know, do you have seasonal allergies? Do you experience some skin issues? Do you have hormonal imbalances plus that chronic pain? I'd be really interested to know how people are feeling, and yeah. I hope that helps someone with chronic pain, most especially because sometimes it's just that piece of knowledge that you need to push yourself forward on your journey.
100%. Thanks,
Awesome.
everyone.